everybody, it's Dr. Catrice Austin. It's Transformation Tuesday, and you guys know I love Transformation Tuesday. Today we're going to talk with one of the top oral educators in the United States, Marsha. Say hello to the people.
Hi, everybody.
You know, there was a big report that came out about 3 weeks ago, something like that, about flossing, and you don't need to do it. Now, as you have heard, don't believe everything that you hear, read, or see on TV, because I'm telling you, they are going to steer you wrong if you listen to this one report, and you'll end up with gum disease and you'll have no teeth by the age of 35, okay? So I want to talk to Marsha because she is an expert in this field. What did you think about the report, and what were some of the highlights that really caught your attention?
The report, I think, first of all, should never have come out that way. I think that it came out as a detriment to the public. What they're saying in there is that string floss is not effective.
Okay.
I don't think they've done the studies, according to the report, to show that it's not effective.
So you're talking about the string floss that we have all used all our lives?
Correct. All the floss that
doesn't work.
Doesn't matter what brand, they're saying that
string
floss is not working.
Okay.
We've seen the benefits. I've been a hygienist for 20 years, so I have seen the benefits. The one thing the report doesn't say is that you still need to clean between your teeth. They just said to you, string floss isn't working.
Okay.
But they never said anything about water flossing not working.
Okay.
And I know that Waterpik has done 60 studies to show the efficacy, and so we are seeing the benefits. Patients do benefit. Their gingivitis is down, their pocketing is down, that distance between the bone and the gum is much better. We like to see no more than a 3 millimeter pocket.
We measure, you guys may have seen the videos where I measure, you saw me get my gums measured. It's something that we have to do in the field of dentistry. If your dentist is not measuring your gums, you have no clue as to the status of the health of your gums.
Absolutely.
Measuring your gums is like the blood pressure readings of dentistry, I would say. So this is how we can tell if your gums and the bone and the substructures are healthy or not healthy. So switch your dentist. I'm telling you right now, if you've never had your gums measured, you need to find a new dental team, and I would be happy to see you, of course. So, Waterpik. A lot of people, now I'm starting to see a lot of commercials on Waterpik.
Right.
Tell me, like, how does this thing work? If you're not a flosser, you don't know how to manipulate the string floss, how does the Waterpik act as a good alternative?
The water flossing is actually done by pressure and pulsation. It's done water right out of your tap, so you don't need anything special. You fill the tank up with water, and then you just follow the contour of your gum. So your gum is scalloped, and you're just going to follow the contour both on the outside by the cheek and on the inside by the top and bottom, everywhere. It takes about a minute, and it's flossing.
A minute to do the whole mouth?
The whole mouth, and you're cleaning between every tooth. You're getting that bacteria out. It's the bacteria that sits there that causes gum loss and bone loss.
So it's not the food that you eat? Because some people are like, oh, I ate some food and that's why my gums are bleeding.
It's the food if it sits there.
Okay.
If you don't get it out, the food will decay between the teeth and under the gum, and that promotes acid, and that acid actually does destroy.
Okay. So would you be able to compare, you know, when patients come to our office, we use like something that squirts out of water, we call it a Cavitron.
Right.
Is a water flosser similar to that? How the water gets underneath the gums?
It gets underneath the gums in the same manner, but there's more pressure.
Okay.
So I would say if you picked up your air and water syringe, that would normally clean away the debris. If you press both buttons down, you get that high-pressured water that cleans, and that's what you're getting in between the teeth.
Okay. So how much would a water flosser generally cost, and where can patients generally get them? And
well, you can go online. Waterpik.com has them. Amazon will sell them. Stores, Bed Bath & Beyond, Target, Costco, all your major stores will have them. And the prices vary depending upon the model, anywhere from about $60 up through $120.
Okay. Now, are there any benefits, because I sell them here in my office, are there any benefits to patients getting them in the office versus going to a store? Because sometimes we recommend it in the office, and then they're like, oh, I'll go online and find it cheaper.
When they buy them in a dental office, if they have flexible spending, they can actually use their flexible spending to purchase it.
Oh, nice.
So it's nothing out of pocket, it's money that they've already set aside.
Mm-hmm.
If you buy it in the stores, if you buy it online, you're not going to get that benefit.
Uh-huh. So, once again, how often do you recommend
To water floss?
water flossing? How often do you recommend patients come in for cleanings?
Right. Patients should be coming in, depending upon the situation, if everything is good, at least twice a year. It's anywhere from 2 to 4 times, depending upon what the dentist feels will benefit you,
Okay.
and the hygienist. So it's twice a year for that. Water flossing, flossing every single day within a 24-hour period. That bacteria starts to harden, and once it does, you're not getting it out with anything you have at home.
There was something earlier that we talked about. You said that you're seeing children
Mhm.
with gum disease and plaque buildup and tartar buildup.
Absolutely.
How does that work? Because a lot of parents out there, you think that your kids can't get gum disease, or
Children
if you
can.
leave it in their hands, that they're just going to do an okay job and everything's going to be all right.
Children can, especially if parents turn over the flossing and brushing to the child too young. They're turning it over when they think they've dressed by themselves, they're old enough to handle their hygiene by themselves. And they're not. They don't have the dexterity, they don't get in there. They're not brushing for a minute, they're brushing for 10,
Really
15,
quick.
20 seconds and they're done. What I tell parents is you have to brush their teeth with them until you can send them into shower, wash their hair, know that all the soap is out of their hair and off their body is clean, and that's somewhere between 8 and 10 depending upon the child.
Because that's a really big responsibility.
Absolutely.
We're talking about their oral
Right.
health.
Right.
And what's the frequency that your children should come in, and when should a child start to floss?
Children should be coming in twice a year, brushing twice a day just like adults. There's no difference, it's just the size of the teeth and the amount of teeth. Children have 20 teeth, adults can have up to 32. So it varies. That's why we tell children a minute for brushing.
Okay.
But they're coming in with plaque, they're coming in with calculus because they're not brushing. They're not brushing behind the teeth on the inside. They brush what they can see and what you as parents can see. They're not brushing everywhere.
When I was growing up, the dentists used to use what we call disclosing tablets. Is that something that is on the market that you know of? It's a tablet, like a red tablet or pink tablet that you would chew on, so the child could know. It would actually highlight the areas where there's plaque and tartar, so you know where to effectively brush. Is that still something that...
There is a rinse out by Listerine, and I don't remember the name offhand, but it does disclose. If not, you can work with your dentist and possibly get some from them
Okay.
and take them home. And all it does is it turns the plaque, the bacteria on your teeth, pink. So they're able to see it.
I'm glad you said plaque, because a lot of people out there don't know. You hear the word plaque and you hear the word tartar. What's the difference? What's the big thing?
Plaque is soft. Plaque is what you're brushing away every day. It's what we now call biofilm, which a lot of people now know that term. The calculus or the tartar is actually hard, and so that doesn't come off with just brushing and flossing.
So you can't brush it away or floss it away?
You cannot brush it. You have to come in and have it taken off with instruments by a dentist or a hygienist.
For all of those people that are at home, how do they know? A lot of people say, oh, my teeth don't hurt, I don't need to really go to the dentist, everything is fine. What are some of the telltale signs that they may have a problem, especially with their gum, since most of America is suffering from gum disease?
Most of America is. The telltale sign is some pink in the water when you're brushing, which is blood because you're bleeding. Bad breath is another one. Having that almost like a cotton mouth, where you feel the substance on your teeth, it kind of feels sticky. Or if you take your fingernail and just rub it down your teeth, if you get anything off, that's plaque.
That is plaque.
So it's bacteria. And bacteria has an odor, and it is never like roses.
So if they have tartar, which is the hardened plaque, what can they do at home? Can the water flossers get it off?
No,
Can the electric toothbrush? Do you use a harder toothbrush? Because some people feel like the harder the brush, the more effective it's going to be.
No, we only want to use soft toothbrushes. Medium and hard toothbrushes actually erode the teeth and can damage the gums.
And cause sensitivity. That's like one of the #1 reasons that people have sensitivity.
Absolutely, because we never scrub. We brush gently, but thoroughly. If you want to scrub, you get down on your hands and knees and do the floor.
So I hope you guys have been inspired. If you have not been to the dentist, we highly urge you,
Absolutely.
highly urge you to come in at least every 6 months. But if you have been deemed to have advanced gum disease, you need to come in every 3 to 4 months as prescribed by your dentist or your dental hygienist to make sure that we monitor you. This is something that is reversible if you do the work. So we're a team. That's what I always like to tell patients. We do our part in the office, and then they have homework.
If you don't do it at home, realistically, it doesn't matter what we do here.
That's true.
If you come in 4 times a year, that's 4 days. 361 are yours to do the work.
That is a good way to look at it. Well, you have been amazing. I hope you guys have learned something today. If you're concerned about the health of your gums, bad breath, the shape and size of your teeth, anything that has to do with your smile, we want you to be confident. We want you to be healthy. We want you to be beautiful and just smile. So give us a call, 212-262-6054. It's Transformation Tuesday. We've got to go take care of one of our new clients.
Yes, we do.
And we'll be back. Bye.